Richixis, my name is Sky Inararity. I am a licensed marriage and family therapist in the Sacramento Valley, and today we will be discussing managing our mental health in the workplace, a value-guided approach. Here is a long bio. I will not be reading it all to you. Please feel free to pause and read at your leisure. The take-home points for it are that I am Northern Sierra Miwok. I am a citizen of the Ion Band of Miwok Indians, and I focus on intergenerational trauma and resilience in my clinical private practice as well as in my academic experiences as a PhD student. Let's talk about two major learning objectives that are going to help guide our session today. The first is we will be utilizing one of the 6 core therapeutic processes in acceptance and commitment therapy, values, and we will explore how value-guided behaviors can enhance our quality of work life and quality of work-related experiences. Second, we will identify common values, explore ways in which we can self-assess how we are acting consistently or inconsistently with our values, and determine ways in which we can make reasonable changes to begin to and to continue to live an overall value-guided life. So what is acceptance and commitment therapy, or ACT? It is a behavioral therapy approach. It gets its name from one of its core messages, which is accept what is out of your personal control and commit to taking action that enriches your life. The primary aim of ACT is to help us create a rich, full, and meaningful life while accepting that pain that life inevitably brings. So it has a very realistic feel to it, an acknowledgement of our personal ability to interact with our immediate environment, and that includes others as well, but it also acknowledges the things that are outside of our control. Um, and this plays into what we'll discuss next, which are the 6 core therapeutic processes in acceptance and commitment therapy. Now, this is just a very brief overview. An entire class, multiple hours long, could be dedicated to teaching about these 6 core processes. So, for the time being, we will be brief and identify them in the following way. So, the first one, and they're in no particular order. They all interact with one another, but for the sake of identifying the first one, contact with the present moment. That's our first one. Values, committed action, self as context, diffusion, and acceptance. And the idea in acceptance and commitment therapy is that by working our way through these 6 core therapeutic processes, we begin to enhance our psychological flexibility, which is really our openness and awareness to experience. Now, to simplify it a bit and to take those 6 core therapeutic processes and kind of summarize them, the ACT triflex does that job for us, where it's simplified into these following 3: be present, open up, and do what matters. When we choose to be present, open up, and do what matters, we increase our psychological flexibility, which then allows us to live a meaningful and fulfilling life. Think about times in your life where you have felt open and willing to experience life. Those are likely times where you were flexible. Maybe not the most excited about the situation, circumstances, or future situations or circumstances, but there was a level of I'm open to the experience. Now we'll hone on this a little bit more, hone in on it rather, and let's look at what this section called Do What Matters consists of. It consists of values and committed action. We can also frame that as value-guided behavior. So, some common values, just for the sake of identifying a few, include humor or playfulness, connection, assertiveness, curiosity, humility, and many more. Now, how does this apply to my work area of life? Well, I'll tell you. We have many areas of life. Work seems to be a primary one for many of us who participate in the 40-hour work week or iterations of it. When work takes up a significant period of time in our daily to weekly lives, it does require us to evaluate how our values are being enacted. And it's also very interesting for us to look at those moments where we experience dissatisfaction, frustration, irritability. And it's helpful to look at those moments and go, am I living in accordance with my values? So let's go through an example together. We're at work. Now, in a clinical setting, this is something that happens often. Conflict or rupture occurs. And let's say, for this example, a client who has difficulty arriving for appointments or following through on attending appointments shows up. However, they show up 10, 15, 20 minutes late. We do not have anybody scheduled later in the day. At this point, those are the facts of the situation, and now we pause. This is probably one of the more difficult parts of this process, is to pause and to take account for all of the facts that are present. All right, so we've paused. Now we're going to move on and we're going to notice. Ask yourself this question: is this conflict or rupture related to my values or value-guided behavior? At first glance, we could say no. But let's pause and think about, in a clinical setting, as a provider, connecting with a client or a patient who has difficulty arriving for sessions. It could be potentially helpful for us to sit with how we are experiencing the value of connection and the value of curiosity. So there's kind of like a twofer, at least in how we're framing this example. There's probably many more values present. But for the sake of this example, connection and curiosity, those are the two primary values that are coming up. Well, we're curious about how this person's doing, and we want to ensure that, they're having a meaningful connection here in a clinical setting. But we also know that folks showing up late can disrupt scheduling. So we're noticing kind of how there is a rub, so to speak, with the situation we're experiencing and our experience of our values. So at this point, we can check in with ourselves. What are my options to respond to this conflict or rupture that are in alignment with my values? For me, in situations like this, I have sat with a person and said, well, I'm not able to get you in right now, but I can get you in towards the end of the day, or we can reschedule for tomorrow. It's an offering, meeting someone where they're at, acknowledging that they are ready to connect, and expressing curiosity about connecting in the near future. And then finally, we can respond with value-guided behavior. We can do what matters. We can assess the situation and see it through in this very contextualized way where our needs, our values are being acknowledged and respected, and we're also meeting the needs of the people that we provide services to. So here are some tips and takeaways. When a conflict or rupture occurs in the workplace, pause. We're just going to pause and we're just going to notice. And then we're going to check in with ourselves and say, what are my options to respond to this conflict or rupture that are in alignment with my values? And this helps facilitate value-guided behavior, that committed action, and doing what matters helps enhance how we experience the world around us. So, today we explored how value guided behaviors can enhance our quality of work life and quality of work related experiences. And we identified common values and explored ways in which we can self assess how we are acting consistently or inconsistently with our values to ensure that we are living an overall value guided, meaningful, and fulfilling life. Thank you.